School, friends, parties, all the normal things that a 16-year-old would be focusing on that distract them from negative thoughts in their minds. I can absolutely see how COVID has played a part of that.
This is the mother of a 16-year-old girl with an eating disorder. And now figures given exclusively to Channel 4 News from one of the country's leading mental health trusts reveals just how many are in crisis. Since the start of the pandemic, they have seen a massive increase in urgent referrals to the children and adolescent mental health services and to their eating disorders clinic. But this isn't happening just here, it is across the country. The surest sign, if you want, of the impact that COVID is having on children's mental health. The number of referrals to the Children and Adolescent Mental Health Service, or CAMS, at the Maudsley rose by 42% between February and November last year. And urgent eating disorder referrals have skyrocketed. They saw a 5-fold increase between July and December compared to the same period last year.
The real difference that I think we've seen during the pandemic is that the children who are vulnerable to develop anorexia seem to develop it much, much more quickly, and more importantly, they get physically much iller quickly. It is obviously far more demanding to deal with something that's really urgent.
She was diagnosed in September of 2019 and then quite quickly went downhill, and in February of 2020 was admitted to something called an intensive treatment programme at the Maudsley.
One of the hidden impacts of the pandemic, that treatment programme was moved online with face-to-face consultations only when needed.
And they did a stellar job of transferring all of that online, but we were caring for her at home, so we had somebody on a screen effectively coaching us to coach her to eat her meals.
The hardest of many desperate moments, though, was when her daughter had to be admitted to hospital.
We were told at that point that due to the COVID restrictions, we would only be able to visit her for an hour per week. So I remember one of my lowest moments, and I know for her too, was the end of that hour's visit, and it makes me want to cry every time I talk about it, because it's such a false hour where it's so hard to have a natural mother-daughter conversation.
This mother has nothing but praise for the support of the Maudsley, yet this is just one trust. And as Channel 4 News revealed last week, the heavy toll of the pandemic means 1 in 6 children are now thought to have a mental health problem.
With the guitar, we're going to breathe in, we're going to count to 2, and then on 3 we're going to breathe out.
This is meditation online, and taking part is 12-year-old Henry Wakeford.
What's the situation that you feel you need to step back from?
The whole coronavirus thing. I feel like we all need to just step back and completely forget what's happening outside and bring all attention to what you want to achieve and just clear your mind.
This is the Now and Beyond on Inside Out Day festival, online of course, linking schools, students and mental health support.
We say this all the time, but we need more funding for mental health services, and we need it ring-fenced. You know, I sat down with the government years and years ago, almost 10 years ago now it was, and they promised this parity of esteem, which we're still waiting for. You know, money for mental health is not ring-fenced.
And this is a toll on the nation's young that could be felt for many years to come.
And if you've been affected by anything in that report, you can go to the Channel 4 website and look for support. That's at channel4.com/support. Well, the Children's Minister, Vicky Ford, herself battled anorexia when she was 15 and has decided to speak publicly about it to try to help teenagers facing similar problems now. I began by asking her if she remembered the moment she realised she had an eating disorder.
Well, to be truthful, no. I think that one of the things that happened to me was that you don't recognise that you've got so sick. I mean, I had quite a turbulent teenage years, I guess. My dad died just before I started primary school, and secondary school. And then I'd been living with different families away from home during my early teenage years, most of which was fine. But then I got to my O-level year, was living with a new family I didn't know well. And I basically stopped eating. I started a diet just after Christmas and just carried on dieting. And I ate apples and not much more. And by the summer term, I was, completely different to what I'd been before. I was very, very lucky to get lots of support from family and friends and others who helped me turn around. But it is a very, very challenging condition for so many, especially young girls.
It's very powerful hearing you, a government minister, talking about this battle you've had. What was it that made you decide to speak about it, and why has it been difficult in the past to speak about this?
So I think it is really difficult to speak about mental health issues. You're sort of worried that if you tell people that you've been vulnerable in the past, that they might judge you in a different way and think, this person isn't as reliable because they've had these issues in the past. But actually, it is so important to talk about it. And I found over the years that when I have met people with anorexia or their families, and I've explained my own experience, it's given them hope and it's helped them to go and ask for help. And I really felt, as I've been hearing the stories during the pandemic, that we do have more people with eating disorders, I really felt the urge to reach out to them and to encourage them. Just the sooner you can get help, the better. But also to encourage people to look after their own well-being at this time. That's so important, because if you're feeling mentally well, physically well, then you're less likely to find that you get a more serious illness.
You say the help's there, but it is incredibly hard to access it, isn't it?
So first of all, we've put into the curriculum a whole part of, through the RSHE curriculum, a whole part of talking to young people about building their own resilience, looking after their well-being and supporting schools with that. Then we ran a project since September, which was called the Wellbeing for Education Return. And this puts schools in touch with local experts so that they can get expert support for their staff as well as their pupils. There's 24/7 hotlines that have been set up all across the country by the NHS for anyone who's in a mental health crisis. So they're providing really super support now. So that's been very good. And then we've also been investing, we'd already invested especially in eating disorder provisions, but £1.4 billion in support for those with mental health issues. And then another 500 million came from the Chancellor recently to increase that NHS investment and really to try and address those waiting times for mental health services.
One thing you hear a lot from parents and teenagers is that schools being closed and therefore students being isolated as a result is having a real negative impact on their mental health. Would you, in an ideal world, like to see schools return in England this month as soon as the most vulnerable are vaccinated?
Well, of course, I want schools to return as quickly as possible, and we've been really clear that schools will be the first to open. The whole of getting education back is the top priority. But what I would say to a parent who's worried about their child at the moment is that the difference between this lockdown in the spring is, of course, the schools saw all of their pupils last term. And if they're concerned about somebody's mental health or well-being, they can offer them a place as a vulnerable child. So the schools are open to vulnerable children and young people. If you are concerned that you think your child's mental health is seriously deteriorating and that they need to be back there now, I would get in touch with your school and say, can they give them that provision as one of their vulnerable children? And the schools do have flexibility to do that.
Vicky Ford, thanks very much for talking to us.
Thank you for having me.